Live na po tayo, but nasa yung link dyan? Okay. Okay. So, naka-live na po tayo ngayon at sinend ko po yung link sa Zoom meeting chat po. Okay. And we will start po in exactly 2 minutes po. So you can go in the chat. Okay. Yeah. Magandang umaga po sa inyong lahat dito po sa Dubai and sa other Gulf countries, and magandang hapon po sa Pilipinas. And we're very happy po to discuss yung Universal Healthcare Act, pati po yung mga Philhealth regulations. And before I get into it po, we want to introduce yung Rights Corridor. So it's a regional news platform that looks at migration issues affecting OFW communities po in the Middle East and beyond. And we're very fortunate today po to have si Dr. Shirley Domingo, our Vice President of Corporate Affairs ng Philhealth, at ang ating Director at Senior Manager po ng Overseas Filipino Program ng Philhealth, si Director Chona Yap. Siya rin po yung dating iLab Director ng DOLE. And our panel members po, si Mr. Ricky Laksa, our GMA News correspondent. He's also a Kuwait Times journalist. And siya po yung host ng Morning Talk Asia. And our chairman ng Philcom community po sa UAE, si Mr. Jason Bukton. And our goal today po are twofold. One is to understand po yung Universal Healthcare Act and yung mga recent PhilHealth regulations that we've been seeing po. And yung pangalawang goal po natin is to clarify po yung mga questions ng mga OFWs sa Middle East region and beyond. And we're also very thankful po that we'll be joined by the OFW communities dito sa Middle East and beyond. And we would like to give thanks po sa OFW Watch sa Libya, sa Philcom group po sa Bahrain, sa Oman, Philcom OFW po sa Qatar, ang ating OFW Watch Libya, and yung Kalayaan 2020, and a number of bloggers po, including Juni Sorsano, Camila Iman, si Noel, and then yung mga officials po natin and researchers sa Philippine Migration Research Network, Catherine Lau sa UPCFAL, and a number of people who've actually shared yung mga links po namin so we could invite a lot of OFWs sa Middle East, kagaya ni Mr. Rico Mondehar, Ani Bangtegan, Neho Alameda, Johnny Crabe, Katrina Montemayor, Oki Olpindo at Kabayan Lalibet. And most importantly po, we would like to thank ang ating labor attaché dito sa Dubai, Polo Dubai, si Attorney Felicitas Bay, for introducing po yung Rights Corridor sa ating mga PhilHealth senior officials. So without po yung support ng Polo Dubai, we won't be able to have itong discussion ito and help our OFWs clarify po yung mga PhilHealth regulations. So without further ado po, I would like to to move na po yung discussion and yung pong presentation ni Dr. Shirley Domingo. So Dr. Shirley, kayo na pong bahala. Dr. Okay. So si Dr. Shirley Domingo po ang ating Vice President for Corporate Affairs Group sa Philhealth, and she can give us more detail regarding the Universal Healthcare Act at yung mga recent Philhealth regulations. So Dr. Shirley, you have the floor na po. So hinihintay lang po natin, very shortly, i-reconnect po. But please prepare po yung mga questions nyo. And I'm very certain na marami mga katanungan ng ating mga OFWs. Titingnan natin very closely yung positibo at negatibong implikasyon ng mga rules and regulations ito. And also suggest ways kung paano natin i-propose yung mga amendments that will be very, very useful po sa mga OFWs po at mga dual citizens din globally. So in a few minutes po, she will deliver yung presentation niya, and i-prepare lang po natin yung mga questions natin. Ni-reconnect lang po namin para at least maging effective at very clear po yung communication. So I think nakalagin na po siya ulit. Dr. Domingo po, can you hear me po, Dr. Domingo? Okay. Joining na po. So habang piniprepare niya po, very shortly po, in a minute or two, you can also look at yung, again, review mga questions niyo and also visit yung Rights Corridor website. So nandiyan po yung mga platforms where we look at different migration issues that affect yung rights po ng mga OFWs dito sa Middle East at sa labas po ng Middle East region. Dr. Domingo, can you hear us na po?
Yes, now I can hear you, yes.
Perfect. So you have the floor na po, and I think a lot of OFWs are very keen to know po yung Universal Healthcare Act, yung positive benefits niya po, at saka yung recent Philhealth regulations. So you have the floor na po. Thank you very much.
Okay, hello. Good afternoon. Afternoon here in the Philippines, pero I'm sure iba-iba ang panahon natin dyan. So good morning, good evening, good noon, whatever is applicable with you there. I hope you guys are okay. I would like to discuss sa inyo ang universal healthcare. Ano ba itong universal healthcare na to? At saka kung anong ginagawa ng Philhealth sa ngayon, no, para maintindihan nyo. Sige, next please. Okay. Ang makikita nyo sa slide nyo ngayon ay kailangan natin reformahin ang ating health system. Bakit? No? Marami tayong nakikitang limitations ng health system natin. I-example na lang natin itong pandemic, no? Although maganda naman ang response natin sa pandemic, sa bagay wala naman talagang any country na nakahanda dito sa pandemic na ito. Pero ang kinabutihan po nito ay nakita po natin yung mga limitations ng ating health system, no? Sa paglabas nitong pandemic na to. Una sa lahat ay pag may pandemic, kailangan natin na mas responsive at mas maraming beds ng hospitals, no? Yan po ang nakita natin dito ngayon sa pandemic. We have to have isolation areas. Yan ang naging problems natin, no? Testing, problema rin natin dito ngayon. Gusto talaga natin lahat matest para kung matest natin, makita natin positive, ma-isolate, no? So ito lahat po ay nakita po natin limitation sa ating health system. Siyempre po tao, kulang rin po tayo ng mga health workers. In fact, nagtawag ngayon ang Department of Health na mga health workers para madagdag natin dun sa mga health workers na nagre-respond ngayon sa COVID kasi marami rin sa health workers natin ay exposed na. And kailangan na rin siyempre silang mag-sub sa ibang health workers. Pagod na rin sila, exposed sila, they have to go into quarantine. Marami pong dahilan yun. But the bottom line is, we have to introduce reforms sa ating health system. No? Sige, next please. And next, okay. So, alam nyo siguro na recently, meron tayong na-pass na law na tinatawag ay Universal Healthcare Act. No? So, ano ba itong Universal Healthcare Act na ito? Next please. Sige, next please. Sige, put it all. Okay, ang Universal Healthcare Act, sabi po natin, kailangan natin i-reform yung ating health system, no? Ang ating Universal Healthcare Law ay it contains provisions on maraming reforms on how to reform the health system ng Philippines, no? Para kung makikita niyo sa slide niyo diyan, basic po ito na sana lahat na may sakit, lahat na may emergency cases, at kahit hindi kayo may sakit ay malusog, ay kailangan may access kayo sa health services. Di ba po ba? Gusto natin na kahit walang sakit ay magpatingin tayo para naman maagapan kung meron tayong mga sakit. For example, meron pala tayo hypertension. Kailangan natin maagapan yon because kung hindi, it can lead to strokes, it can lead to heart diseases. Ganun po. Dapat early detection. Dapat magpatingin para sa early detection. Pero kung may sakit kayo at may emergency, then dapat may access lahat ng Pilipino. Dapat hindi maging sa gabal na kung wala kayong pera ay hindi kayo makakapagpatingin. Kung malayo ang mga health providers, hindi rin kayo makakapagpatingin. Hindi dapat ganon. Lahat po yan ay kailangan na ma-solve natin para lahat ng tao, lahat ng Pilipino ay may access sa healthcare, no? Ngayon, doon naman sa pagbabayad ng healthcare, kung wala kayong kakayahan magbayad, ay makalibre ng healthcare, no? Kasi kung hindi naman pwede na wala kang pambayad, hindi na magpapatingin. Kailangan na ma-access nyo rin ang healthcare because that is your right, no? So, yun po. And kung may kakayanan man magbayad, ay at least maging predictable ang payments, no po? Na kung magpapatingin kayo Sana alam nyo eksakto magkano babayaran para may time kayo maghanda ng pera. Yung tinatawag natin na fixed co-payment sana. Sana alam nyo eksakto magkano babayaran nyo. So that in a nutshell is sana ganon ang health system natin. Sa ibang bansa, alam ko marami ng ganyan, no? Binabayaran lahat. Kunyari, ang narinig ko, siguro meron dyan mga taga-Canada o taga-Europe. Maganda raw yung health system kasi libre lahat. Tama po yun. Sana papunta rin tayo doon. Pero tandaan nyo po, malaki ang nagkakaltas sa taxes nila. Ang dinig ko, mga between 40 to 60% ang nakukuha sa taxes. But yung kapalit nun ay talagang yung social services ay pinapaigi ng mga bansang yon. Sige, next please. Next please. Okay, dun sa provisions ng Universal Healthcare Law na ito, sa service delivery po ang feature ng Universal Healthcare Act ay ini-integrate lahat ng healthcare providers. Ano po ibig sabihin nito? Doon sa law nito, doon sa province level at saka sa city level ay may mga referral networks. Lahat ng hospitals, government muna tayo, lahat ng government hospitals ay dapat may mga referral. Dapat integrated sila and integrated rin sila later on makikita nyo to primary care providers para kung magpatingin sila kunyari outpatient, kailangan ng referral sa hospital, madaling ma-refer sa mga hospital na to dahil integrated na ang healthcare delivery system. No? Sige, next please. Yan yung isang feature ng law. Next please. So sinasabi natin dapat may two-way referral system. Ano pong ibig sabihin nito? Kung meron kayo sakit, magpapatingin kayo sa outpatient, no, sa primary care provider, at saka sa ng primary care provider, kailangan magpatingin kayo sa ospital, kailangan mag-ospital kayo, hindi natin kaya po yon. So dapat i-refer na kayo dun sa ospital, sila po ang magiging navigator ninyo. Kung ano man mangyari sa ospital, kung kailangan kayong operahin o kailangan kayong ma-admit, pag natapos na po yon, treatment nyo, kailangan ibalik kayo sa community na, ay meron rin referral pabalik dun sa community at meron rin titingin sa inyo, no? Para tuloy-tuloy ang serbisyo. Ito po ang tinatawag na integrated na po lahat ng healthcare delivery system. And integrated siya from promotive, preventive, to curative, yung magpapagamot, rehabilitative, and palliative dun sa pain care. Sige, next please. Part rin ng Universal Healthcare na ito ang tinatawag na Primary Care Provider Network. Ibig sabihin po nun, lahat ng Filipinos dapat, doon sa law na yan, ay nakaregister sa isang primary care provider. Ang ibig sabihin nun ay magpapatingin sila ang mag-aalaga sa Pilipinong yon in an outpatient basis. Part rin ng law says Philhealth should come out with a benefit na outpatient comprehensive including outpatient drugs and medicines and emergency services. So yung nakikita nyo dyan sa phone nyo ngayon o sa screen nyo ngayon ay yung medical outpatient, nakakabit na yan sa mga birthing homes, nakakabit na yan sa pharmacy para sa outpatient drugs and medicines, nakakabit sa ambulance kung kailangan dalhin kayo sa ospital o kung saan man kailangan kayo dalhin sa imaging, mga chest x-rays, mga laboratories, nakakabit na po dapat yon. Kung nakaregister kayo sa outpatient provider na to, dapat meron silang referral to all of this networking na ito. So dapat integrated na ang primary care provider networks na ito. Sige, next please. Sunod po. Okay, kaya ang Philhealth po ay nagpaplano, we're developing a benefit. Ang tawag po niyan ay konsultasyong sulit at tama. Ito po yung outpatient benefit natin. No, yung sinabi kong lahat ng Filipino under the law should be registered to a primary care provider. So lahat po 'yon. At sino magbibigay ng serbisyo, mag-accredit po kami ng mga outpatient facilities, primary care facilities, hindi lang po government like rural health units, kundi pati mga private clinics pwede rin po sumali dito sa programang ito na konsulta, no? Kami po ang magbabayad sa mga primary care providers na ito through a capitation. Ibig sabihin, may exact amount kami na ibibigay per person para alagaan ang mga nakaregister sa kanya ng mga Pilipino. No? Tapos ang mga benepisyong kasama po dito ay mga initial consultation outpatient, mga follow-up, at mga diagnostic, mga laboratorio po, mga CBC, mga complete blood counts, urinalysis, kung kailangan. Hindi po lahat ay mabibigyan ng ganon. Kung kailangan, base dun sa assessment ng doktor, then ipapalaboratorio sila. Kasama rin ang mga drugs and medicines, kung kailangan rin po yun. Kunyari, meron nakita na diabetic pala yung tao, then kailangan niya ng outpatient medicines for diabetes, then kasama rin po dapat yon na ibibigay sa kanila. Sige, next please. Yun po ang tinatawag na konsulta. Sige, next. Ay, ito lang po yung sinabi ko, again, part of the konsulta package, nasabi ko na ito, kung ano mga laboratories at yung mga drugs and medicines. Sige, next please. Sige, next. Ay, ito rin po ang malaking maganda sa ating Universal Healthcare Law. Lahat ng Pilipino ay automatikong miyembro ng Philhealth. Lahat po na yon ng Filipino, hindi na kailangan magpa-member pa kasi member na kayo, automatic na po yon. No? Tapos, yung tinatawag rin, ito ay isang magandang ano rin yan, ay immediate eligibility. Ang ibig sabihin po nun, kung kayo ay magkasakit, dati po ay rini-require namin ng 3 months, dapat na may bayad for the past 6 months, at naging with sufficient regularity, naging 9 months for the past 12 months. So yon ang pero ngayon hindi na po kailangan yon. Ang kailangan lang natin kung magkasakit ay may tinatawag ng immediate eligibility, pwede na po mag-avail kaagad. Pero syempre nakakabit doon na magbabayad regularly ng premiums. Pero kung nakaligtaan magbayad, magbabayad pa lang, naabutan na kailangan magkasakit, hindi ho kayo i-deny ng benefits ninyo because of this immediate eligibility. Sorry. Sige, next please. Next please. So, pag-usapan natin dahil hindi naman libre yung ganitong health system, no? Ang contribution paano ibabayad? Paano natin babayaran ang ganitong klaseng health system? Syempre po 'yon, katulad ng any health insurance ay mga premiums ng mga members. Kailangan po lahat tayo mag-contribute sa fund na 'yan. Sorry. Patawag yung OP, kailangan pumasok na sa president. O tawagan mo. Diyan ka lang, ikaw na lang. Hindi, sa kanila, punta ka na lang. I'm very sorry ha. Sige, ikaw na bahala. Kay Tin. Okay, very sorry. Okay, balik po tayo. Yung ganitong health system po ay hindi libre. Kailangan may magbayad po, no? Since lahat naman tayo makikinabang at one way or another, lalo na sinabi ko, under the consultation, outpatient benefit kailangan na, hindi lang hospitalization. Hindi lang kung ma-hospital kayo ay may gamit kayo ng Philhealth, hindi na po yun. Once ma-implement natin ang konsulta, kahit outpatient, may pakinabang na kayo sa magagamit nyo na yung benefits ng Philhealth. No? So, kailangan po, meron tayong kino-contribute dito na funds. No? Hindi naman po libre lahat to. So, meron pa rin tayong babayaran na premiums. Isa po yun. One of the funding rin, dun sa mga walang kakayanan magbayad. No? Ito yung na-identify ng DSWD na wala silang kakayanan magbayad. Doon sa mga senior citizens, indigent, PWDs, ang magbabayad ng kanilang premium, hindi rin po sila libre. Pero ang magbabayad ng kanilang premium, since wala silang kakayanan magbayad, ay ang national government. Ang senior citizens at PWD, may special law po yun na national government ang magbabayad ng kanilang premiums. Kasama rin sa funding nito ay galing po sa mga sin taxes. Ang tawag sa ang sin taxes po ay dun sa taxes na kinukuha natin mula sa mga sigarilyo at sa mga alak. Yun po ang sin taxes. So yun ang binabayad, pinagkukuhaan ng national government premiums na yan na subsidy. Part also of the funding is yung galing sa PCSO. Pero hindi po lahat ng charity fund nila ay pinapabigay sa Philhealth, no? 40% lang po of charity fund ng PCSO ang mapupunta dito. Tapos sa PAGCOR rin, meron silang binibigay na fund rin sa national government. 50% of that fund will go to universal health care. Sige po. So, sige, next please. So, ang bagong premium rates para sa lahat ng direct contributors, doon po sa Universal Healthcare Law na ito, dalawang klase lang na contributors. Ito ang direct contributors and indirect contributors, no? Direct contributors, kasama dyan yung mga employed, migrant workers, and yung mga self-earning, lahat po yun kasama, no? Sorry. Okay. Kasama po lahat yon. And ito po, nandito po yon sa law na lahat ng direct contributors ay magbabayad ng ganitong premiums po. Makikita nyo sa screen ninyo na nandun yung exact tier, the premium rate, and the income floor at income ceiling. No? Anong ibig sabihin po nun? I-explain po natin yung income floor at income ceiling. Ang ibig sabihin po ng income floor ay 10,000 and below ay pare-pareho na ang babayaran. Kung 2020, 3%, then at 10,000, that's 300 a month. No? Ang income ceiling naman, lahat ng 60,000 and above ay pare-pareho na ang babayaran, that's 3% of 60,000. So kahit kumikita kayo ng 90,000 or 100,000 or 120,000, ay 3% lang of 60,000 ang premiums natin. So mag-increase ang premiums na ito ng 0.5% every year hanggang umabot ng 5%. Yung income floor ay pareho pa rin, 10,000, pero mag-increase ang ceiling up to 100,000. So ibig sabihin nun, by the time 2024 comes, yung 100,000 and above, pare-pareho na ang babayaran. Yung between 10,000 and 100,000, 3% of your salary. Itong contribution na to, nasabi ko na mahalaga po ito para mapalawak natin ang benepisyo ng Philhealth po, no? Sige. Okay, sige, next please. Next. Okay, so ito pong universal healthcare na ito ay dahan-dahan po ma-implement lahat ng provisions na to. Ang na-mention ko po earlier na maraming provisions to, maraming reforms ito. Hindi kaya na pag effective na universal healthcare ay lahat na yon ay nandyan na. Hindi po ganoon. Because kailangan, marami pong gagawin. Maraming reforms, maraming gagawin. Inuumpisahan po natin ito katulad ng sinabi ko, yung automatic member na, immediate eligibility, konsulta, lahat po yon kasama po yon sa pag-umpisa na ng universal healthcare. Pero marami pa hong gagawin sa universal healthcare at dahan-dahan po natin ma-achieve ang universal healthcare hanggang umabot tayo dun sa sinabi ko earlier, yung ideal health system natin. Sige, next please. Next. Okay, updates naman po natin. Ito yung ibang karaniwang benepisyo sa Philhealth, no? Binabayaran natin na case rate, lahat po ng medical conditions na kailangan ma-hospital, inpatient, ay meron case rate. Example lang dito, ang nakikita nyo, dengue fever, tumataas na po, one of the top 10 natin ang dengue fever dito sa Pilipinas, ay lalo na ngayon na nag-umpisa na tag-ulan, ay hopefully wag muna magdagdag itong dengue fever sa ating COVID. Kawawa naman ang Pilipinas kung magka-epidemic rin tayo sa dengue fever. Anyway, ang binabayaran ng Philhealth po dyan, 10,000, acute gastroenteritis, 6,000, urinary tract infection, 7,500. Sige, next please. Para yon sa example lang po yon, no? Example lang po yon. Meron rin tayo outpatient. Hindi, yun nga ang sinasabi ng iba na kung hindi kami ma-hospital ay hindi namin gagamitin ang Philhealth. Hindi po totoo yon. Kasi hemodialysis po, yon marami na po tayo nag-hemodialysis ngayon. Tens of thousands na of Filipinos nakikinabang na sa hemodialysis benefit na ito. Nagbabayad po tayo ng 2,600 per session for a total of 45 sessions, but kung meron kayong dependent na meron rin 45 days, then umaabot ng 90 sessions ang ginagamit ng hemodialysis. Meron rin tayo para sa cancer, radiotherapy, no? Cobalt therapy, 2,000 per session po ito, and linear accelerator, 3,000 per session. Ito yung madalas sa senior citizen po natin, cataract extraction, one of the top payments rin po ng Philhealth yon. Ang bayad po natin yan, 16,000 per mata. Sige, next please. Ang Z-benefits, ano po ang Z-benefits? Ito po ay para doon sa ito, okay. Sorry about that. May nagtatawag. So ang Z-benefit para doon sa mga sakit na catastrophic. Ang ibig sabihin po noon ay mga sakit na matatindi at kailangan ng mas maraming pera pambayad doon. Mag-example na tayo, kidney transplant. Ang Philhealth ay nagbabayad ng 600,000 para sa kidney transplant. Bypass, mga heart bypass po, 550,000. Leukemia, 500,000. Tetralogy of para sa puso yon doon sa mga bata, no, 320. Peritoneal dialysis, 270,000. Sa mga cancers, breast cancer, nagbabayad tayo dyan mga 100,000. So malaki po ang nakikinabang, maraming nakikinabang sa Z-benefit na yon. Hindi lang maliit ang bayad dyan, malalaki po yon. Anong ginawa natin dito sa COVID response na ito? Anong ginawa po ng Philhealth? Una po ay nagtabi tayo ng mga 30 billion para ilagay sa mga ospital. Kasi pandemic na nga, no? Hindi natin alam kung sinong ospital ang mangangailangan. Kaya ito 12.3 billion na ang nailagay natin sa mga hospitals, pero nagtabi tayo ng mga 30 billion panglagay sa mga ospital. Para saan? Para doon sa mga protective, personal protective equipment nila, para doon sa mga gamot, para doon, marami po, malaki po ang kailangan pag na-hospital kayo ng COVID, kaya mag-alaga po talaga tayo, mahirap ma-hospital sa COVID. So naglagay na kami ng mga pera sa mga ospital dito para may panggastos na sila at hindi na sila hihingi parate, hindi na sila mag-a-apply. Parate every time may claim. Nandun na yung pera sa kanila. Okay. So umabot na yan ng mga 13 billion. Example lang ito ng mga ospital doon sa mga taga Davao. Southern Philippines Medical Center, naglagay kami dyan ng mga 325.7 million. Sa PGH, kung saan dinudumog ngayon ng COVID cases, ay 263 million na ibigay namin doon. Sa Davao, umabot sa Davao Regional, mga 208 million. Sa Cebu, Vicente Soto, 203 million. Sa Baguio, meron rin dyan. Sa Pampanga, yun po, nakikita nyo sa screen nyo, hundreds of millions po ang binibigay namin sa mga ospital para sa COVID na to. Next, please. Next. Okay, meron rin, alam nyo naman po na napaka-importante ang testing dito sa sa ano na to, sa COVID pandemic na to. Kailangan po ma-test para kung positive ay ma-isolate kasi kung hindi makakahawa siya ng ibang tao. Kailangan rin po ng pera dito. Kaya nagbigay rin kami ng 100 million sa Philippine Red Cross para tumulong sa kanilang testing. Iba pa dun sa mga pagbayad namin sa mga testing na ginagawa sa iba't ibang hospital. So ang Philhealth po ay nagbabayad rin po ng mga testing dito sa Pilipinas. Sige, next please. Sunod. Ito ang testing package natin. Makikita nyo kung magkano. Makikita nyo rin kung magkano ang bigay ng Philhealth dun sa pneumonia package o yung COVID niyan. Kadalasan kasi pneumonia ang komplikasyon. So umaabot mula sa 43,000 plus hanggang sa 786,384 para doon sa critical na COVID. Aside from that, meron rin tayo community isolation package. Kasi nga, after matest, makita na positive or may suspetsya kasi hinihintay pa results ng test na siya ay COVID, kailangan po ma-isolate yun kung meron na siyang symptoms. So pati yun ay binabayaran ng Philhealth sa halaga ng 22,449 per person. Sige, next please. Sunod. Sige, next. So magkano ang binabayaran? Sige, next. Sunod. Ayon sa datos namin, doon sa regular payment ng claims, ay nakapagbayad na kami ng 97 billion. Actually, ang binabayaran ng Philhealth ngayon, mga 2.5 to 3 billion a week in claims, no? Tapos yung pumapasok na claims sa amin, umaabot yan ng mga 1 million claims, number of claims a month. A month po yun. So, dyan makikita nyo yung mga claims po natin, no? Maliit. Maliit dito, hindi ko mabasa, pero siguro nababasa nyo dyan. Palaki natin. Ayun. Yan. Okay. Ito po, hindi nakahiwalay dito pero masasabi ko po sa inyo na sa mga OFW po ay umabot ng mga last year 2019 umabot tayo ng mga 1.7 billion ang bayad natin doon sa mga OFW claims. Mga 70% of that ay para sa mga dependents nyo dito sa ito po. 1.7 billion and 70% of that ay dito sa mga dependents nyo dito sa Pilipinas. Ang na-kolekta naman doon sa contribution ng OFW ay umabot ng 1.02 billion. Okay, compared to the claims of 1.7 billion. Sige, next please. Sunod. Update. Okay, ito sasabihin ko pa lang, no. Alam ko maraming nag-react dito na OFWs, no. And naunawaan naman namin 'yon. Pero let me just say this, that yung circular po na lumabas, actually naglabas na kami ng circular on the increase of payments based on the law last year pa noong November. Alam namin na mahirapan ang ibang mga OFW sa pagbayad nito. Kaya yung lumabas na circular nitong April ay ginawa namin flexible ang terms ng pagbayad. Kung babasahin niyo po, nakasulat po doon na sa 2020, pwedeng magbayad lang ng OFW ng 2,400 initially, and then the balance, pwedeng ibayaran, hulugan in 12 months time. 1 year po. Diba? So, in 2021 naman, ang paunang bayad ay 3 months and then the payable and then the rest is payable again in 1 year's time. So, doon po makikita nyo na naintindihan na po namin doon pa lang, bago pa lang nagreklamo ang mga OFWs, ginawa na po natin hulugan actually ang bayad ng mga OFWs doon sa premiums po nila. Sige, next please. Sunod po. Okay. Yun lang po, last po yun. Masasabi ko lang sa inyo, galing lang ako sa meeting earlier with some members of Congress, inaaral po ang pag-amenda ng law na ito. Hindi po natin alam kung ano pa ang kalabasan, pero inaaral na po yun. So yun lang po at salamat po.
Maraming salamat po, Dr. Domingo, for giving us po yung very comprehensive explanation po sa ating Universal Healthcare Act, pati yung recent Philhealth regulations. So maraming salamat po. And I think marami kaming natutunan doon at yung positive effect niya rin, especially po both locally and abroad po. And we would like to have po yung ating director, si Director Chona Ya, and pati po yung mga panel members natin, si Mr. Ricky from GMA News, correspondent po siya sa Kuwait Times, and sa GMA News and sa Kuwait Times, and si Mr. Jason po ng Philcom Community, plus po yung mga online questions po natin. So, Director Chona, can you hear us po? Hello?
Yes.
Okay.
Can you hear me?
So, yes po. So, I would like to open na po yung floor para po kay Dr. Domingo, Director Chona, sa inyo po, pati mga panel members natin, and sa lahat po ng manonood globally, specifically sa Middle East and Singapore, Asia. You can ask the questions na po, and we will relay po lahat ngayon. So, I think I want to start with Mr. Ricky from Kuwait.
Thank you. I'd like to direct a question to you. Nice to see you again. I've seen you in the Philippines a couple of times. So, question ma'am, kasi po naguguluhan kami. The question that came out was the 3%. Then,
Mr. Ricky, yung boses niyo po, medyo laksan niyo po ng konti, sir, para po marinig namin kayo ng fully.
So, okay lang? Can you hear me?
Parang may glitch, may extra sound po kami naririnig. Parang yung static po yung sound.
Baka may static. Okay, can I just arrange it? Is it okay?
Okay,
Is it
can
alright?
you? Okay, I think much better. Okay,
I can
much
hear you.
better. Okay.
Okay. Kasi when the 3% came out, it's true, no? Talagang marami talagang nagwalang OFW. One more thing is that bigla kasi it came out on a time when we do not expect these things to come out in public. You know the pandemic is, it's widespread, and you got 40% of the OFWs overseas are not working because of the no work, no pay scheme. And then when this thing suddenly came out, it became like a huge issue. In fact, within the community itself, became bigger than the COVID-19. So the OFWs are just asking, kasi naguguluhan po sila eh. The president, Duterte, came out with saying that it's going to be voluntary. Pagkatapos ngayon, ang sinabi, it's voluntary daw yan, or suspension, hindi nila alam eh, kasi there were like a couple of things coming out from two different departments. And then secondly, ang lumabas ngayon, Ma'am Domingo, you're telling something that it's going to be hulugan naman. It's going to be installment. Now, which is which? You're imposing three things: suspension, voluntary, and now you're saying it's hulugan. Alin po ba sa tatlo talaga? Ang totoo.
Okay, I mentioned that yung lumabas na April before the outcry of the OFWs, that was the basis, di ba? Kaya nga nag-outcry ang OFW because of that circular. So nauna yung circular na yan, which the OFW reacted to. So this is the circular that says hulugan. Okay? So now, I said after that, after the outcry, then Congress is looking now at amending. I don't know what will happen to that initiative of Congress. I don't know. So it's still ongoing. They're studying it. So there's nothing confusing, I think, there. Ngayon, the announcement of Malacanang, we're still waiting. It was announced by the spokesperson. Right now, we haven't received any formal directive on this. We're still waiting for it, for us to be able to plan for it and to come out with specific guidelines on it. But until now, we have not yet received any formal directive from Malacanang. And therefore, I cannot comment on any specifics of that.
Moderator, I just wanted to say that the question came from the president of the Coalition of Filipino Community Organizations. We're going to honor that question.
Okay. So, Mr. Jason, I think you have a lot of questions then, representing the UAE community in particular. please ask them kay Dr. Shirley and kay Director Chona.
May I
Hello.
add something,
Yeah.
Roy?
Yes po,
Roy?
Director
May I
Chona.
add
Yes po.
something?
Of course.
Okay. Ang Philhealth kasi is the implementing agency of the UHC law, no? And so we implement what is contained in the law, and then we drafted the implementing rules still based on the law. Kaya yung schedule of premium contributions, it is in the law, and kinompute lang ng mas detalyado doon sa Circular 2020-0014. So, yun ang basis ng outcry ng OFW. Nakita na nila in real peso terms yung translation ng premium rate per year per salary range. So si Philhealth naman ngayon, and because of that outcry, si President Duterte said nga na, o sige, voluntary na lang ang OFW. But hanggang ngayon, wala pa kaming formal directive from the Office of the President kung paano yun gagawin. That is why, until that directive is given to us, we remain to implement the law as provided for, and in fact we have started deduction from the monthly salaries of people employed in both the private and government sectors. Katulad namin ni Dr. Domingo, automatic dinideductionan kami ng yung tamang percentage sa aming sweldo. Yun. Lahat na employed, dinideductionan yan. Yun lang, may ka-share kami na employer. Kasi 50-50 kami nung aming employer. So, kunyari, yung aming monthly deduction ay 600 something, 654 sa 20,000 na sweldo, kahati namin dyan yung aming employer. So, the employer pays 300 plus pesos. Kami rin, 300 plus pesos. Yun po yung paghimay nung batas as it is being implemented right now. So yung circular na nabasa nyo itong April na wrong timing nga nilabas yun kasi ini-explain nga, kino-compute nga lang yung magiging bayaran ng OFW. Yun lang po yun.
Maraming salamat po, Director Chona,
Thank you.
sa explanation po yun. Siguro po naging confusing din sa mga OFWs po yung statement mula sa Presidente pati yung expectations sa Philhealth kung paano nila i-implement ngayon. Kasi nga po merong feeling ngayon na voluntary na, nag-change na yung policy. But in reality pala, hindi pa. At naghihintay pa po yung Philhealth po sa atin. And ngayon po, yung 3% po, specifically po sa Middle East, marami po kasing mga kababayan na no work, no pay, tapos delay yung mga sahod nila. So yung tinatanong po ng mga audience po, let's say nawala ng work yung isang OFW at one point in time within that 1 year period. Yung hinanakit nila, yung may penalty, and a lot of them say it's hindi nila kasalanan na walang sila ng work at mataas pa rin yung premium sa kanila. So I wanted to ask you po, ano po yung responses sa kanila, lalo na yung mga OFW ngayon na wala po trabaho ngayon, be it po sa Middle East o sa Asia?
Well, kung walang salary, wala naman basis for paying premiums, no? That's why we're studying it now that kahit nasa abroad kayo, ay how to make it na part kayo ng indirect contributors kasi nga salary nga ang bayad ng premiums. Kung walang salary, wala kayong babayaran. But you have to be paid through the indirect contributors. So inaaral po lahat 'yon. Secondly, for those who are paying naman, yes, there's penalty. Yung penalty is part of the law. Kaya lang, since ginawa namin hulugan 1 year to pay, actually ang first of all, under the pandemic, we extended the period of payment, no? Hanggang end of May. Ngayon nag-expand kami ECQ, but pinag-aaralan pa yan. But as of now, the policy is end of May. So sabihin natin magbayad end of May. After that, after 1 year pa. Therefore, the penalty will not come in until after 1 year of payment. So malayo pa siya. But as I said, Congress is studying the situation and for possible amendments. Hindi po natin alam what will happen there, but they're studying the situation. They're studying the provisions and seeing kung kailangan i-amend.
Yung pong danong ni Dr. Marla Assis, sabi niya po sa message niya, mahalaga sigurong ipaliwanag ang basihan ng deductions ng contributors dito sa Pilipinas at sa OFWs. Bakit ganito ang pag-calculate ng contributions? Most likely, the contributions were based on actuarial studies which would sustain po yung Universal Healthcare Act.
Yes, the table, the 3% was actually, nag-start pa yun dun sa dati naming law, RA 7875, kung saan na-establish ang Philhealth, 1995 pa yon. In that law kasi, sinabi na pwede mag-increase ng contributions ang employed sector up to 5%. But nag-stop kami sa 2.75% of the salary. For many years, nandun kami sa 2.75%. Therefore, nung universal healthcare, we started with a 2.75, so in-increase sa 3%. Ang masasabi ko rin, hindi lang po OFW, na-mention na ito ni Chona, ang may ganyan kasi under the, dati kasi yung before the universal healthcare, the OFWs, iba-iba po ang ating membership sector. So hiwalay yung OFW, they paid a fixed yearly premium. This year, under universal healthcare, dalawa lang klase, direct at saka indirect. Ang direct, pare-pareho lahat. Tayo lahat, pati kami, direct, and that's 3% of the salary. So pare-pareho po lahat yon. So kasi yung iba may under the impression that OFW lang ang na-increasean ng premiums. Hindi po totoo yun. Lahat po ng direct contributors will be paying the same.
Thank you po. Jason, I think you have a question po, representing yung UAE community po.
Yes, good morning, by the way, Director Chona and VP Shirley. Ako po si Jason from Dubai, representing Dubai and the Northern Emirates. I have collected a series of questions from our Filipino community here. One of that is the universal healthcare has not been properly presented to the OFW. Tapos bigla na lang kaming nagulat. All of a sudden, it will be implemented without laying its benefits. And by the way, your presentation, VP Shirley, was very, very informative and very comprehensive. How do you think OFW will avail if they are not fully informed? Were there any representations of OFW or any of our representatives during the legislation period prior to its approval?
Yes. The answer there is there were a lot of consultations done prior to the signing of the law. When it was still a bill, there were consultations done. After the signing of the law, when we were drafting the IRR, marami rin consultations dyan. In fact, there was one consultation only for OFWs, manning agencies and recruitment agencies, and Chona can talk more about that. The whole orientation was only for them. Aside from that, pag lumalabas ang OFW from here, ito yung mga land-based, no? They have to attend the PIDOS na tinatawag, the Pre-Departure Orientation Seminar. That's where we discuss universal health care. And therefore, and again, Chona can talk about that. There were a lot of people who attended that seminar. Therefore, if you were one of those who left the Philippines at the time after the signing of the IRR, then you should know also about universal health care and even the increase in premiums. But Chona, can you explain more about that?
Jason, good afternoon. Good morning, John.
Yes, good afternoon, Director.
Yung sa consultation, even prior to the drafting of the law, ang Congress has held several consultations with stakeholders, relevant stakeholders. And so, meron naman tayong lahat ng mga representative ng OFWs, no, OFW representatives sa House. They were represented in the consultation, and they also called NGOs involved in migrant workers issues, mga manning and recruitment agencies, they were invited. Pero kami, at least yung OFW group sa Philhealth ang nag-represent niyan, mga bosses namin. And then pagdating din sa Senado, meron din yung consultation. Hindi yan mangyayari kung walang consultation sa relevant NGOs representing OFWs. Nandun din ang ating mga representatives ng OFWs. Kami naman sa Philhealth, we tried our best to reach out to the OFW groups, mga NGOs, pati mga ahensya, kasi meron silang mga PDOS centers, and through them, we want to channel the information. We also gave mga modules, no, orientation modules to these agencies para ma-reach out. Yun nga lang, itong implementation na we wanted to go to Dubai to kasi during Independence Day, no, last year, hindi naman kami natuloy. Tapos early this quarter, merong mga invitations din sa mga Philippine community groups. Hindi din kami natuloy dahil delikado ng magbiyahe, no, because of this pandemic. So yun, but maybe I must admit also na kailangan pa rin talagang mag-reach out kasi sa lawak ng mga bansa, sa lawak ng areas where Filipinos are working, hindi talaga namin ma-reach lahat. At mabuti, nagpasalamat ako dito kay Froilan at kayo na you tried to intervene on behalf of our kababayans there in the Middle East area, no. Yun lang.
Director Chona.
Yes.
Sorry if may follow up lang ako. I mean,
Go ahead.
From our point of view as OFW, it's very ironic that this Universal Healthcare Act will be implemented, and then all of a sudden we felt like we were not fully represented during the legislation or during the time that it was not yet approved in the Congress. I know that the Philhealth,
Yes.
I know that the Philhealth is only the implementing agency for this act, but we felt, I think Mr. Ricky also would agree with me. Now, we were not really fully represented during that time, and it felt like it is unfair. Going back, by the way, to your point that in the Philippines, you're co-paying the PhilHealth percentage, which is about half, or let's say 1.5% of what you're paying, and then the other half will be paid by the employer.
Yes.
In the case of OFW, we don't have
Yes.
any employer who would pay for us half
Correct.
of the. Yes. Have we considered that, especially if this will be reopened or if this will be amended?
Yes. According to the lawyers, ang pag-amend ng isang batas will take only after 2 years can a law be amended. So we are preparing for that, and our actuary is already busy making the computations for that eventuality, because we realize, ako mismo dati I've been always working with OFWs, no. I know na nabigla talaga kayo because your premium contribution was the lowest, among the lowest, no. And then yun nga, biglang nagiging mataas. So we hope that when the law is amended, it will be more forgiving. But kami sa Philhealth, until that is amended or there is presidential action, we will continue to implement the law as it is prescribed currently, no? So,
On,
yun na nga, we
Chona?
will wait for the instruction of the president for the voluntary nature of the OFW's contribution. Yes,
Chona,
Doc.
actually, yeah, can I? Okay.
Yes,
Actually,
Dr.
just before this, I was in a meeting with the chair of the Congress, chairman for the Committee on Health, no, Congressman Tan. And we discussed all of this. The
Okay.
effect of the law, iba-iba yan sa different types of OFWs. I know, alam naman natin yun. Ibig sabihin, there are seafarers, there are land-based, there are dual citizenships, there are permanent residents abroad, there are students without work, there are students with work. So iba-iba po yun. And we know iba-iba ang effect ng law na ito sa inyo. Because like for example, the seafarers, they have employers na pwedeng makihati doon sa premiums na ito. So we alam namin yon, we discussed this with the as I said, the committee chair of the Committee on Health of Congress. There are several bills already in Senate, tatlo actually from Senator Bongo, from Senator from also from Congress, no? Meron rin 'yon. And two others from anyway, there are several bills already in Congress that will try to amend this. So yun lang masasabi ko.
Senator, Congressman Salceda.
Yeah,
Meron
so
siyang
said
proposal.
and there are two from Senator Bongo. Yes, so there may bills na nga, and as I said, the committee chair, Congressman Angelina Tan, we just had a discussion with her. So alam po namin lahat to, and we're discussing with her. So it's really, the ball is now really with Congress.
Salamat po doon. Ricky, I think you have a lot
Yeah.
more questions. I
A
can
lot
feel.
of questions actually. Ang daming tumatawag dito. One thing is this, ang nag-comment dito is something like, he's an architect. Why can't Philhealth be an option just like another insurance company? After all, it is an insurance company. Many insurance companies offer a better scheme, unlike Philhealth, which is not acknowledged in most of the hospitals, especially private ones. He also said that you mentioned that, Ma'am Shirley, that this amendment is going to change on and on until you get the ideal scheme of what a universal health law is all about. Until when are these OFWs going to wait for this? They're going to be paying, and most of them probably migrate to other countries. They might not be able to go, they might not be able to go and avail of this thing, So another third question goes in: would there be a rebate? Are you willing to give refund just in case you're not able to use it for a year? Would that be like, parang mayroon bang may funds sila na pwedeng i-refund just in case hindi nila nagamit yan within a year? And then they can go on, paying again for the year. Marami rin akong nakuha dito, ma'am, na a comment about they're not against it. They're not against the 50%, but it's just that it was implemented in the wrong time. And secondly, they felt that it was a gunpoint thing on the head, that if you don't do this, well, you're not going to be processing your OEC. And again, another thing came out after that, and OEC is denying it, saying that they have nothing to do with this. So which is which now? That's a lot of questions. I'm sorry.
Okay,
Yes.
Can I answer about the OEC?
Of course, Doctor. Yeah.
Siguro yung nagsalita ng ganon hasn't been home for a long time. Because since 2015, Philhealth was no longer a requirement to issuing the OEC. Since 2015. So I'm sure that those who are mentioning that haven't been home in a long time, and they haven't gone through POEA.
Ma'am, may I back in? The thing was, there was a circular that came out. I think Jason knows about this, saying that it's like a gunpoint thing that says if you don't do this, it's easy. We all received it in the Middle East. So I was just questioning now, where did that circular came from? Saan po galing yun? Kasi lahat kami sa Middle East natanggap. Did you
Nagulat.
get that? Yes.
Of course.
Okay.
Yeah.
It was mentioned as mandatory, in fact.
Yes. I think Dr. Domingo will answer it, and Director
Yes,
Chona.
in the implementing rules and regulations of universal health care, it says there that OFWs, when they leave for abroad, will pay Philhealth premiums, and that the OEC has to be connected with the premium payment. But that has not been implemented. We have been in talks with the OWA. It's not implemented as Chona says, starting 2015 when the one-stop shop of OWA was stopped, we never connected the premium payments anymore to the OEC.
POEA
So
yon,
that
Doc
already
Gigi.
stopped.
POEA.
POEA. Okay, so that's already stopped. So there's no such thing at the moment. They picked it up maybe because it's in the IRR. And I tell you, discussions were being done, but nothing implemented yet.
I think po yung naging fear po ng mga kababayan natin is yung intent to link yon. Although wala pa kasi yung governing board po ng PhilHealth and ng POA, they have to decide yung protocols and guidelines, etc. So, nag-project. So, siguro yung kinagalit po ng mga OFWs yung intent to link yon, and I think yung naging uproar ng mga OFWs po. Yeah, yun po. I think
But
Dr.
as I said,
Director
we can
Chona,
assure them.
yeah.
We can assure them that it's not being implemented yet. And now that we know the sentiments, then probably POEA is listening. They assured the OFWs in a recent statement that this is not being implemented.
Director Chona, I think, yeah. So.
Yeah, Froilan, if I may butt in. Yeah, in fact, we have seen a notice from OWA, especially here in Polo OWA Dubai. They have released the same statement as mentioned by Vice Shirley regarding this matter. So hindi pa po naka-connect yung PhilHealth and related to OEC what do you call this releasing.
Yes.
Ricky.
Mayroon din akong question dito. I think this is a very good thing that we can look into, para sa PhilHealth. Instead of daw po of giving an encompassing like about 3% if you wanted to go impose on these people, they have nothing against it. Many of them don't have. First things is, they need to get more information how extensive is the membership up to when sa family nila kasama. Kasi there's nothing mentioned about it. Sino ba kasama dito sa 3% na ito pa nagbayad sila? Lalo na yung mga OFWs, sino ba ang beneficiaries nila? I think we need to explain that. Secondly, gaano kadami sa family ang uncovered dito? Second po is, why don't you create packages instead of imposing a 3% on it? Let's say at 1.5 there is this, at 2 this is this, at 2.5 and at 3 this is how it is. So because that would give the option for the OFWs to choose. So I would say that, I'll take this because this is, I think I can afford it, and at the same time, well, this is what suits my family and the needs of my family. Instead of the usual, 3%, that's it, that's the law. You know,
Dr. Domingo,
Rick,
yeah.
Yes.
If I
okay. Yeah.
If I may add also sorry, may add lang ako konti sa question ni Sir Ricky, because that's also a common question of our Filipino community here in Dubai. Sabi nila, bakit hindi na lang magbigay ng category or options? Like, binigyan nila ako ng example. Thank you very much to Karen, by the way, from Kabayan, who had given me this information. What if you are a PhilHealth member but you are an gumawa lang siya ng parang category. I do hope na may parating din to sa kinauukulan. First category or first observation namin is, what if you are a PhilHealth member but you are inactive? You can activate the membership and benefits yearly upon the will or without any charges. Number 2, if you are a PhilHealth member active, you don't have any dependents. So I'm talking about the single OFW that can avail international coverage. Number 3 is PhilHealth member who are active with dependents in the Philippines. Number 4 is PhilHealth member active with dependents in the Philippines who can also avail international coverage. And the fifth category is, if you are a PhilHealth member and yet you don't have at all any dependent in the Philippines, since say your parents are also paying PhilHealth, your brothers and sisters are also paying PhilHealth in the Philippines. So basically, you don't have any dependents at all. Have we considered that?
Okay,
Question.
first of all, in answer to several questions that you put up, PhilHealth is managing a social health insurance, not a private health insurance. And in fact, there are big differences between the two. One is we don't compute, we don't put a maximum on the number of people that comes in, the maximum age. We don't compute the risk and the underwrite. That's what you call it. There's no underwriting here, meaning if you have these pre-existing conditions, then you pay this much. No, we don't do that. We pay social health insurance is based on the principles of solidarity. Those who can pay will pay. Those who cannot pay should be subsidized. It's solidarity, no. Therefore, with that in mind, somebody asked if you can just activate it. Sorry ha, because the other speaker medyo basag ang dating. I couldn't get the whole thing that you were saying. But what I can say is there part of the law is that once you're a Filipino citizen, you're automatic members. Meaning, any OFW who decide to come here, let's say on a vacation, and get sick and needs hospitalization, you will be automatically, because it's part of the law, eligible for benefits even if you did not pay your premiums. But later on, we collect premiums, no? So because that's automatic membership. Another thing is many OFWs come back here to retire, no? Once they come here to the Philippines, because of the law of senior citizens and also universal health care, if they are 60 years old and above, they don't pay premiums anymore, but they are covered by all benefits that are given to them and given to those paying members. Diba? So because of that principle, if they come back here and retire here and they're free of charge, but they can avail, that would be also unfair to those who were paying and contributed to the fund while they were productive. Aside from that, a lot of people also has dependents here, and I gave you the statistics of this. 1.7 billion was spent and 70% of that was for dependents here. As I mentioned earlier, we understand that there are different kinds of OFWs, that there are some who doon na talaga sila, the whole family is there. They don't have any dependents here. They're also paying HMOs there.
Yes.
So we alam namin yon, and that was discussed in the earlier discussions, and hopefully that will input into whatever amendments that Congress will be doing. So yeah, we understand all those categories of OFWs. Earlier
Mhm.
kasi the law only said direct contributors, all the direct will pay 3% of their salaries. So yun lang siya. But now I hope with that realization, then we will be able to segmentize not only the OFWs, maybe the individually paying. That's one thing good about this outcry, because they are reviewing now the details, the implementation of this law. I'm sorry, I
Ricky, I
didn't
think
get the whole thing that the other speaker was
Ricky,
talking kasi
yung speaker
basag
niyo
ang
po,
dating.
idikit mo.
Basag ang
Yeah.
dating sa akin.
Sorry. So how is
Maybe
it
you
now?
want to ask one by one yung questions so it will be like clearer if I didn't answer pa the other
Can
questions.
you hear me now? Can you hear me clear?
Yes, I can hear
Perfect.
you now.
Okay. Sinagot niyo na po yung first question ko kanina regarding the option. Why is it an insurance company? You said it's a social insurance, so you don't compete. That's a very good answer. I think we all understand that now. Secondly po yung kanina, tinanong ko rin about the yung pagbibigay ng packages. You also answered it, which is quite good. Actually, ma'am, ang gusto ko lang ipaabot sa inyo ngayon, since you're having difficulty on reaching out to the OFWs in the Middle East, at wala naman kayong attached agencies when it comes to the rest of the other embassies and the consular departments we have in the Middle East, why don't you assign locally someone, train them locally, and deploy them here? Or not deploy, maybe yung existing officials natin dito. So it could give you a more wide perspective of how you can reach the OFWs, because I'm sure Jason, being a community leader, diba? may access yun sa lahat ng mga organizations.
Mhm.
So they can
Correct.
create this. So it will be more understandable for all of us. What PhilHealth is all about. And ang ganda ng benefits niya. Ako personally, ngayon ko lang nakita. Ang ganda pala ng benefit niya. Although I do have a lot of questions, but still. So yun lang.
I think I want to add very quickly lang po doon. So yung polo po natin, they don't really deputize yung mga health agencies dito sa host country. So I think it's a really interesting element to look at po, lalo na sa mga conflict zones. Yung mga kababayan po natin, what they say is, minsan either wala silang day off or they're having difficulty na magbayad on time, and they fear na if they don't pay on time, baka they will face penalty. So yun po yung mga klaseng concerns na even si Margarita from Singapore even highlighted po. So I think po yung role ng PhilHealth agency, perhaps, I know that's gonna cost some, you're building a new institution outside. So I think maybe yung comment po ni Director Chona and Dr. Domingo po. That would be
and you know what, Paulan, they need to understand also that karamihan ng nasa Middle East, I would say like in Kuwait, 250,000 Filipinos, and you have 60% of the domestic workers. Most of them are contained in house. You're right. So there has to be a way that we can reach out to them, explain to them, kasi sila ang mostly mangangailangan nito dahil they come from families na nangangailangan ng tulong. So I don't know, I'm just suggesting basically how.
Yes, Director Chona.
May I answer that, Froy and Ricky?
Yes po.
Actually, before this pandemic, we already made representations with DFA about posting some representatives in selected countries abroad, no? We have made that. Some countries already had positive reply. Yung iba, we're waiting, no? Selected lang muna yung may mga malalaking OFW populations, no? But yun na nga, even DFA is already also at they're also confused now, especially with the pandemic. There are a lot of repatriations, no? So parang that's where we're at. We are ready to deploy, but ang official deployment will take some time because we will have to abide by DFA's protocols. They have to make representation in the host country, and then we will have to wait for their acceptance. We also considered yung binanggit ni Ricky that we can piggyback. Actually, that was the first proposal, to piggyback with other agencies represented overseas. But we thought that ang mga representatives ng mga polo and SSS and Pag-ibig, sila mismo, they were saying that they are ang mga SSS and Pag-ibig, they have quotas, no? So they can also accommodate our possible piggybacking. And another thing we had to consider was that we will be audited by COA, no? I think all these agencies will be audited by COA. So parang it's so difficult to justify now yung mga expenses allocated for persons outside of PhilHealth. So we are at that stage now. In fact, we have chosen some people for possible deployment. Unang-una nga yung UAE, because we know that you are over 1 million Filipinos in UAE.
Correct, ma'am. Correct.
Yeah. Close to 1 million, if not more than 1 million. We have already considered Abu Dhabi and Dubai. I think they have already replied to DFA. We're waiting for DFA's feedback to us so we can already deploy. But with the pandemic, parang hirap namang mag-deploy. So we are now trying to also use take advantage of available contactless online technologies for payment. Para mas remote ang pagbayad, so you can pay in your office or from your apartment, bills sa Philhealth and other agencies for premiums. So that's what we are also considering now.
Opo. Dr. Domingo, very quickly, one question po. So yung assumption na all OFWs have insurance dito, it's entirely wrong. So maraming mga OFWs dito na walang insurance, and I can see yung possible role ng Philhealth dito. So yung question ko po dito at ng mga audience din namin, kay Mr. Book, tinatanong po dito, ano daw yung maximum reimbursement package that they could get? Let's say, for example, I get sick sa Dubai, and punta ako sa hospital, magkano po yung maximum na pwedeng ma-avail ng ating mga kababayan?
Depende yon sa condition. Kasi meron tayong case rates. Meron tayong app doon. I don't know if they can download the app. It's all case rates app of Philhealth. You can just key in the medical or surgical condition there and sasabihin sa inyo magkano ang mabayaran. So we pay case rates, ibig sabihin ng fixed rates depending on the condition, and the OFWs can reimburse those rates. Admittedly, it might be small compared to a dollars na kasi doon abroad no? And I don't know how much medical care is abroad. I don't know. I really don't know how, but they can reimburse up to the maximum of our case rates. Now, they can send their documents to us through Chona's office, and it will be reimbursed to them or to their families here.
Ma'am Shirley, going back to that, kasi we had some OFWs na nag-feedback. Sinabi nga nila that they were trying to reimburse whatever hospital expenses they have here in Dubai. Ang tanong naman nila, bakit daw mabagal ang reimbursement procedure at ano po bang ginagawang hakbang ng Philhealth?
Okay. May I answer that, Jason?
Sige, go.
An OFW who gets sick abroad can reimburse his expenses, but ang reimbursement niya is Philippine peso denominated. So for instance, nanganak yung asawa niya abroad, we reimburse him kung ang asawa niya ang nanganak for CS 19,000 lang, even if they spend, let's say, $2,000 abroad.
Correct.
That's what
Understood.
they get. Okay. Now they have 180 days to file the claim. Okay, 180 days from the date of charge. So that's 6 months. Kami naman sa Philhealth, pagdating nila dito, we also have 180 days to process. Kasi may evaluation pa yan, etc., etc. So we are also given the same amount. So, pero kung mabilis naman ang aming processing dito kung kumpleto ang dokumento. Ang dokumento na kailangan, the documents that are needed is an official receipt, a final diagnosis, which is translated into English, and other supporting documents. Meron pa kaming claim form yan. Yun ang ipapadala nila by email or by mail or by courier to our office, and we will pass this on to the regional office where they come from.
So, ma'am, pwede pala magpadala ng email kasi I have meron din nagsabi sa akin dito from one of the groups that hindi daw tumatanggap ng email, only through courier daw. Please confirm.
Okay, email para maumpisahan yung proseso, and you can send the original by mail, by courier. Kasi minsan hindi klaro yung sa email, di ba?
Right.
Yes po. So I think we have 10 more minutes na po. I know marami po rin kayong mga activities. So I wanted to ask final questions po from our guests and clarifications din po sa ating kay Dr. Domingo and kay Director Chona. But I want to start with Ricky po. I think you have a final question po. Yes.
Ma'am, my final question. Mayroon pong, I came upon a couple of websites petitioning for the abolishment of PhilHealth. At the same time po, they're still coming from the OFWs. Yung isa po is change.com something, and the other one was International OFWs against PhilHealth. So this is the thing. So nanghihingi na po sila ng petition and signatures online petitioning for the abolishment of PhilHealth. Ma'am, if you are, umpisahan ko muna kay Ma'am Shirley, no? Then after that kay Ma'am Chona. What would you say to these OFWs for you to convince them to agree that PhilHealth or universal health care is essential to them?
Well, I said earlier that the health system has to be reformed. The Philippine health system needs to be reformed. Philhealth is a strategic purchaser. We are the funding arm of universal health care. As I said, we handle social health insurance, which is very much different from a private health insurance. So we are implementing the law. I saw that the change.org, I saw that petition actually. Well, yung answer ko dyan is PhilHealth is implementing a law. And if they want any amendments to the law, then they probably have to petition the Congress or the designers of the law, not PhilHealth. Our hands are tied as to the implementation of this law. Although we can always broker for them and talk to Congress. No? Regarding what was the second, I didn't get that, abolition of PhilHealth. Did I get it right? Okay.
It was a question.
Well, as I said, if we abolish a social health, it's not because I'm here, but if we abolish a social health insurance program, then we go back to individual healthcare program. That is already seen as not being effective or efficient. That will cost more actually, because everything will be out of pocket. There will be no pooling of funds. When we pool funds, then we can pay more or control prices more. There will be none of that. It will all be out-of-pocket payments and individual care. And that is not equitable, because that will only be advantageous to those who can pay. How about the poor? How will they pay for services? They don't have money in their pockets to pull out. So that's the only thing I can say.
And I think Jason, I think you have a final question.
Actually, I'm so sad that I'm not able to ask a lot of. I have a bunch of questions right here to ask, but it's okay. We are running out of time. Before my question, I just want to point out that the 6 months processing in the Philippines for the reimbursement for the OFW might be too long for the OFW to receive what he deserves. Masyadong mahaba. I do hope that PhilHealth.
It's just Jason, it's just a maximum. Maximum. Right. Pero pinaprocess naman yan kaagad basta kumpleto ang documents. Yun ang ating kumpleto ang documents. Kasi anong gagawin ng PhilHealth kung hindi kumpleto? Pabalik-balik tayo. So kailangan kumpleto na ang documentation para ma-process agad. Some naman ma-process in 1 month. But it's just part of the rule na kung sila, they were given time to submit within 6 months, diba? Ang layo ang haba ng palugit na yan. We also should be given maximum yon. It's just a maximum, but we process it very quickly.
Thank you very much, Ma'am.
All documents complete.
Understood, Director Chona. Let me just share an experience of mine when I was also hospitalized. By the way, I have medical insurance here in the UAE, and that is very common also to all of our kababayans here. They have more or less mandatory medical insurances from their company if they are employed. But sa kabila po, I mean, my personal experience was, katabi po ng bed ko is actually a visit visa who came here in the UAE. He was trying to find a job. And then in the middle of the job hunting, bigla na lang siyang nagkasakit. I think may tubig na nasa kanyang baga. and he had to undergo operations. To make it short, walang-wala talaga siya. He's a visit visa, walang pera, but he was able to be accommodated in the hospital here in the UAE. And during discharge, namumblema siya how he can pay the fees. May Philhealth siya sa Pilipinas pero hindi niya alam kung paano gagawin. He does not have any friends or relatives to get money from. Good thing is I was able to assist him to approach our Philippine Consulate General of Dubai, the Northern Emirates, si Consul General Paul Raymond Cortez, and he was able to assist yung visit visa natin na nasa loob ng Rashid Hospital at nakalabas naman po through the help of Congen. But going back to that, I feel like I suppose our government will be able to put this into consideration, the different conditions of our OFW, and yung 3% po masyado pong mataas, especially during this pandemic time. It is sad that everyone in the country and the world is financially challenged during this trying times. We feel that this is not the best time to bring this to the OFW because of the hardships brought by the pandemic. Are there any possibilities that the IIR will be postponed?
The IRR is already implemented and in effect. As I said, we have a window here because for OFWs, 1 year actually. I said 1 year before. When if you pay the initial payment, you have 1 year to pay for the rest of the payment. So that gives you 1 year before penalties can be implemented. But right now, they're already looking at amending the law. I don't know how fast it will be. I don't know what will the amendments look
Yeah.
like. But I can assure you that our congressman, because we talked to them, I talked to them myself. No, I was in the
So-
meeting there.
So
They are
sorry, Miss.
aware of all types of OFWs. So they realize that.
Yeah, pasensya na po kung masyadong makulit, but ulitin ko po yung tanong ko. Can we just postpone the IRR after the pandemic, if we may? Because
Yeah.
based on our study, about 60%, 60 to 70% right now in the UAE or in Dubai, in the Northern Emirates, had been duly affected. No work, no pay, terminated. Ang dami po talaga. Can we just please consider that, since the pandemic will not happen every single year, it might happen every 100 years. So can this be a special consideration for our government?
I answered that earlier. The IRR is actually part of the law, and we should be implementing the law. As I said, we already made it through the circular. We already made it flexible terms. But if kung matuloy yung amendment, maabutan before the implementation of that 1 year, that's the window there na hindi na matutuloy yun, kung ma-amend yun. So as to, kasi if I showed you, di ba, the table dun sa law itself, nakasulat doon 23% of the salary. That's the law. And therefore, we can only change that if the law is changed. But we are looking, we will handle, we will study it, and the Philhealth is committed to do everything within the law to be able to address your concern.
Quick last only. Bakit po may 5% na increase every single year?
No, it's not
0.5%.
5%.
0.5, sorry, 0.5, sorry, 0.5.
0.5%.
Yeah. Bakit po mayroong 0.5? Yes.
Yes po.
Sorry. Na-explain ko na ito, di ba? So, it started last year up to 5%, and it was carried over only under this law. So we started 2.75% because that's where we are. So up to 5%. Now, the computations of this in last year's law, I'm not privy to that, so I wouldn't know exactly how that was arrived at in the previous law. But we're just carrying over that provision to this law.
Before I highlight po yung some of the key points dito, I think I want to hear kay Director Chona and Dr. Domingo yung mga last notes niyo po. I want to give a quick brief, lalo yung mga audience natin pa iba-iba kasi, so I just want to make sure I give them a full briefing before I end po yung session natin. Director Chona, I want to start with the last message niyo po sa ating mga kababayan dito sa
Okay.
Middle East and Asia.
Thank you for this opportunity for Philhealth to explain the UHC law of 2019 and how it it's affecting the OFWs. Now, with all your suggestions, I also recommend that maybe you can put together a list of proposals, no, for the House and the Senate. You might know your sectoral rep. You can course it through them or through any other representative, including the Senate. Si Senator, si Congressman Salceda has his own proposal. Maybe you can catch his before it's being submitted. And then si Senator Bongo is also very active. He has his own proposal. But in the meantime, as Dr. Domingo has mentioned earlier, Philhealth is the implementer of this law. So we cannot change any of the provisions. We can only implement. But on the case of the OFWs, we will have to await the instruction of the president on the voluntary nature of your membership and contribution. Yun lang po ang we cannot promise here and now what can be good for you because everything will have to go through the process. No, we're sorry about it, but maybe you can also look at the tables carefully. Kasi mahal na rin kasi ang hospitalization din ngayon. It's not very cheap. Yung iba nga, we realize yung iba yung lowest contribution is just about the text money. That's what we tell them. Yun lang. Thank you very much, Froilan, for organizing this
Maraming salamat po. Yeah.
meeting. Thank you very much.
Thank you po. Dr. Chona, Dr. Domingo po.
Again, I would like to thank you for inviting us. Thank you very much for this opportunity to be able to talk to our kababayans abroad. Talaga may limitations kami how to talk to everyone out there, no? Siguro dapat dalasan natin yung mga ganito, and we want to reach out to all people like you who organize
We love
this.
that.
Thank
Yes,
you po.
we will also like this. I talked already. This is my third time in these past weeks to talk to groups of OFWs. So thank you very much for this. We hope to be invited here again. I would just like to say that universal healthcare is a very nice piece of legislation because it introduces good reforms. No? If there is something wrong in the way some provisions are done, and specifically I'm talking about collections, then let's try and amend that portion. But let's not give up on universal health care. Social health insurance means risk pooling. Ang ibig sabihin lang nun, you're sick, you're still included. You can still avail, you'll still pay the same premiums. No? Risk pooling, social solidarity, bayanihan ito, no? So there's a lot of nice things about universal healthcare. Maybe limitation also was on our part. Maybe hindi namin na orient kayo mabuti on this, but we can always change that. But I hope that we don't give up on this because it's the most equitable thing to do. To be able to make sure that those kababayans natin dito na walang pera to pay for healthcare can still avail of the same set of health services that we people can pay for. So yun lang po yun, equitable distribution, equity in access of healthcare. Yan po ang linalaban natin. Salamat po, and please keep safe everyone during this pandemic.
Maraming pong salamat sa inyo, Dr. Domingo and Director Chona. And sa lahat po ng mga nanonood, I just want to recap very quickly lang po yung mga key points that we've talked about all throughout sa 1.5 hour na discussion na po dito. There's 6 of them po. One is yung issues of information. It's very clear na we are struggling to get reliable source of information, iba-ibang interpretations, and I do think yung role ng hopefully yung health attaché natin sa mga diplomatic missions could really close yung asymmetric information na yon and really allowing mga OFWs din, lalo sa mga conflict zones o yung mga OFWs na nag-work sa mga premises ng mga employers nila to effectively communicate and gain a lot of information regarding po sa role ng PhilHealth dito at saka sa Pilipinas. And yung issues of representation po, it's very clear to me na ngayon at sa ating mga guests na yung mga domestic OFW representatives sa Pilipinas, there seems to be a big disconnect. Kaya nung napasa to, you could see this huge uproar, lalo yung mga petitions that Ricky has mentioned. So yung representation matters a lot. And more importantly, now we could clearly see, sabi nga po ni Dr. Domingo, na inaaral pa ng Kongreso to. And I think we could collectively channel yung mga sentiments natin and constructive feedback and recommendations sa ating mga officials, lalo na yung mga senators and congressmen malapit na yung election. And if they really want to help yung OFW natin, I think we should also, step up yung game natin and help mobilize yung mga communities across Middle East, Asia, and Europe para naman marinig po ang ating mga hinaing. And more importantly po, yung issues of yung recent announcement ng ating Pangulo, klaro po yan sa ating mga audience na yung gobyerno po natin, Administrasyon Duterte, has not really communicated yun sa PhilHealth. Kasi po mataas yung expectations sa PhilHealth. Lahat ng memes dumidiretso sa PhilHealth, but we have to understand na implementing agency yung PhilHealth. At yung law ngayon, yung 3% na yon, it's being in effect na yon, sabi nga po ni Dr. Domingo. And I think we need to be clear doon at i-channel lahat ng mga sentiments and feedback natin sa central government, yung mga framers po ng law na yon. And yung reimbursement, it exists. I-download po natin yung app ng PhilHealth. That's very, very important po. And I think yung last point po na sinabi ni Dr. Domingo, let's not give up sa Universal Healthcare Act natin. I think it's a great piece of legislation po that could really equalize yung access ng mga OFWs at saka po sa mga family nila who are struggling, especially in times of COVID po. Maraming salamat po, Dr. Domingo, Director Chona Yap, Ricky from GMA sa Kuwait, and Mr. Jason po sa Philcom ng UAE. We will actually create, thank you po, and we will create yung, we will communicate and we'll have that document. And maraming salamat po sa inyo, and we look forward to having another session in the future po. Maraming salamat po.
Okay, feel free to email us or text us.
Yes
Thank
po.
you.
Thank you po. Bye-bye po.
Thank you. Bye.
Bye.
Bye. Thank you, ma'am.
Thank
Ingat.
you.
Okay.